It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. I always enjoy it when I get to meet a new physician at the Indiana Regional Medical Center, and IRMC does have a new physician, and we'd like to introduce him to you today. He is Dr. Gakwaya Habiyaremye. How did I do?
Very good, very good. Uh, Usually the last name is really difficult for most people, but you did very well.
I just tried to take a swing at it. I figured if I tried to do it phonetically, I'd be in trouble, so just take a swing and see what you do. It's good to have you and good to meet you.
Thank you, sir. Thank you. It's a pleasure to be here.
Folks watching them on our Facebook page right now, you can see the best combination of a bow tie with a shirt and a suit that you're ever going to see with the doc here this morning. Primary care physician at IRMC. That's not a usual path, I think, for folks to think about. When they think about IRMC, they think, oh, okay, they're the ones the primary care physicians send people to. But in this case, as a primary care physician affiliated with IRMC and located within the IRMC campus, it's a great chance for folks to take advantage of your services. Primary care is such an important part of the medical formula, and so that's what you're doing. Why do people need to have a primary care physician in their lives?
Well, thank you. First of all, thank you for having me here.
My pleasure.
Um, and so primary care, I think, is really the backbone of medicine.
Hmm.
Um, Usually, and I think the cornerstone of it is not only treating disease, but it's more like disease prevention or stopping the progression of ongoing disease or even reversing or curing some diseases.
Hmm.
So that's why I think that primary care service is really the cornerstone of healthcare.
One of the interesting aspects of it to me is the whole idea, and I liken it to people with a car, taking a car into the dealership. You take it in, you get the routine maintenance, the lube, oil, and filter, and they can check out the different aspects of that car to make everything is ship shape and is good to go. In a way, that's what a primary care physician. That's one of the roles of a PCP.
Right, right. That's exactly right. I think the privilege of a primary care physician is to kind of have a bird's eye view into a patient's health. And the greatest task is to look at every single disease process that's happening, affecting different organ systems in the body,
Hmm.
and kind of putting it together and come up with a comprehensive plan overall how you're going to address these issues as individually, but also holistically. So I think there's no other specialty that can do that except primary care physician who's able to just take a look at everything that's happening. It's like a concert conductor, you know.
Oh, okay.
So
Yeah.
yeah.
Yeah. I sort of liken it to this as well. When you go into the emergency room, when something emergent happens and you have to go to the emergency room, if you're going in there, whether you're being wheeled in by somebody or walking in there with whatever that emergency might be, for them to have the ability to call upon already established records, to see what kind of a health record you have, what your body is all about, would be such a tremendous advantage right from the very start versus having to build it up from the very start with nothing to go on.
Right, right. Exactly. You know, and I think that's this is why it's important to really have somebody invested into your health before establishing care with a physician who's going to take a look at your overall health and make documentation of everything that's happening with
Hmm.
in your health. And that way, if anything happens, God forbid, if you end up going into an emergency care or urgent care, and then there's some records of what's been happening in your health, and that really helps anyone who's going to take care of you knowing what's already happening in your life and your health. So I really I believe that um, we all this healthcare that we have here, we should really build it upon the primary care service.
Yeah, yeah. I guess establishing that baseline is important as well to keep you from having to go to the emergency room in a lot of
Exactly.
cases.
Right.
keep you out of there. That's a pretty good idea as
Yeah.
well.
Yeah.
Yeah, and so you look at the things that a primary care physician will do. For instance, somebody who's say between 40 and 50 years old who doesn't have a primary care physician says, "Well, I want to go see the doc now," and we'll talk about where you are in the new walk-in clinic
Right.
in a couple of moments. But I want to get established with the doc right now. And you can get those baselines for that person and begin a relationship with them that in the long term is really going to help them in their whole healthcare footprint, isn't it?
Absolutely, absolutely. And I think there's a misconception in a lot of people who think that you only go to see a physician if you're sick, if you're not feeling well. But I think we really need to actually go when we are healthy,
Hmm.
managing health and prevent becoming sick.
Yeah,
You know,
yeah.
I think that's really, if there's one point that I can stress is to really seek a relationship with a primary care physician,
Hmm.
even when you're not sick.
Yeah. So
Even
that's where the concept of an annual wellness checkup would come in.
exactly,
All right.
exactly,
All right.
yes,
Find out what where your health is right now. You can make
yes,
adjustments then, and
yes.
yeah.
And so this the concept of annual wellness visit is really an opportunity for a physician and a patient to kind of sit together and create a, a plan or come up with or update a plan, a personalized plan, if you will, to
Hmm.
address either ongoing health issues or to even come up plan with preventing for a person to become sick.
Hmm.
So this is it happened once a year. It's usually an extensive kind of overlook on in one's health, and
Hmm.
where you kind of assess all the health risks that a patient has,
Hmm.
and based upon the risks and evaluating things like cognitive abilities, depression, uh, assessing if especially in the elderly to see whether there's some risks of hearing impairment, vision impairment, things that can actually become a huge hazard for a patient to
Hmm.
get into some health trouble. So we during this visit we kind of go over all these things and come up with a personalized plan to better assist or serve this individual or this patient to kind of halt the disease or treat the disease that you have. But this is the only opportunity that we get to go through every single problem. We create a problem list of a patient
Hmm.
and we address every single problem. And this is the every year it's like maintenance
Sure.
for your body.
Yeah.
Um,
Yeah. And there are annual things that need to be done, things
yes,
that might not be annual but need to be just checked on, monitored,
right.
and of course all of that is going to depend on who you are, what age you are,
Yes.
what your body has gone through, and your sex. All of those different things will figure into all of that. Now you have been working in the new walk-in clinic in the Overlook building, which most folks are familiar with, but you've moved recently.
Yes. So there's a new location which has service for walk-in clinic as well as urgent care clinic and primary care service. I happen to do both primary care service there, but I also can I see some walk-in patients.
Mm-hmm.
It's a brand new place, and most people are not aware of that location. But it's open. We began working maybe 2 weeks ago, I believe.
Yeah.
So now it's up and running, and we're ready to take care of some more
And it's in the
patients.
former Urgicare location, which as you
Yes.
pull onto the campus, if you're coming from the Wayne Avenue side, it's going to be really the first edifice that you come to there in the parking lots to the right as you pull into the parking lot and to just walk through those doors and I think hang a left and you're in the walk-in clinic,
Right,
correct?
right. If the emergency room is just right adjacent to it. So
Oh, okay.
so I think most folks know where the emergency care
Yeah.
room is. So it's just the building right in front of it.
Yeah, yeah, that's a good way to put it as well. And the signage is there, so that it's very easy to find. And people who have experience having gone to that urgent care location before now know where the walk-in clinic is. So obviously, from your accent, we know that you're not born and raised in Indiana, PA, but you're here now. So where have you come from to come to us now?
So I was born and raised in Rwanda.
Hmm.
It's a nation in eastern aspect of Rwanda of Africa, eastern
Hmm.
part of Africa. It's a very small nation with 10 million people. I moved to the States about 22 years ago. So I've been living in the
Hmm.
States more than, longer than I lived in Rwanda.
Did your medical training all come here in the States, or was it overseas as well?
No, I actually came when I was young. I went to uh, undergrad here. I went to Penn State University for undergrad.
Oh, okay. Hmm.
I did biochemistry and molecular biology there, and then I did my medical training in Nashville, Tennessee, at Meharry Medical College,
Hmm.
where I did a combined program with Washington University in St. Louis, where I did my master's in clinical investigations there.
Hmm.
And then I ended up staying in Nashville for the internal medicine specialty training, which I finished last year, and I moved here in Indiana in last October.
So you've just been in the community for about 6 months or so.
Right, right.
Yeah. What's it been like for you? Is it a community that is like another community that you've lived in, or is this a whole new experience?
You know, I think Indiana I grew up in a very smaller community,
Hmm.
and I always I like smaller community and rural, kind of rural. So this is kind of brings me memories from my childhood, and I like the peace and slow kind of paced life that you
Yeah.
find in the smaller communities.
Yeah.
Um,
And in primary care, of course, one of the things about what you do is getting to know your patients on a very personal level, which I would assume in a smaller community, a rural community like this, makes it much easier.
Right, right. I mean, this is a place where you can walk in your community, in the grocery stores, and you run into some of your patients or
Yeah.
some, it's really nice and pleasant when this happens. And you really don't see it in big cities,
Yeah.
So,
Yeah.
yeah.
Well, it's so good to meet you and to have you here with us in Indiana and at IRMC. If people want to get established with you as their primary care physician, is there a phone number to call, or how do they do that?
Yes, so there is a call center. There's a number that they can call, and it's 888-452-4762.
Very good. Say it again.
888-452-4762.
And do you wear a bow tie every day?
No, this is just special for your show today.
Really? You wore your radio bow tie today. Beautiful. Beautiful. He is Dr. Gakwaya Habiyaremye. I did better the first time around than I did the second. But it's so good to meet you, and welcome to Indiana. I look forward to having you here for a very, very long time.
Thank you, sir. It's a pleasure being here. Thank you so much.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.